COVID-19 has claimed the lives of nearly 200,000 people in Peru. There, the vaccination campaign is only slowly getting underway. Just 16% of the population are completely inoculated. The country is battling several coronavirus variants. Experts say Latin America is fast becoming the new epicenter of the pandemic. More than 1 million people there have died. The only exception is Chile, where 80% of the population are fully vaccinated, in a region where otherwise health systems are struggling to cope. Hello and welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Colombia is experiencing one of the longest peaks of infections since the coronavirus arrived in the country. This third spike has put the medical system to the test. Quarantine measures have been struggling to strengthen an already strained system. ICUs in the country's second largest city, Medellin, are over 95% occupied. Doctors insist that the national model of pandemic care has failed.
On the streets of Medellin, everything seems normal. The country is in the grips of a third coronavirus wave, but there's little sign of that here. It's a different story in local hospitals. The suffering there has taken a heavy toll on nurse Yolanda Valderrama. My mother was here and my brother, both at the same time. It was hard. My brother survived, but my mother died of COVID-19. I'm still here. The grieving process is very hard. But I also take comfort knowing that they did everything they could for her. More than a year into the pandemic, these medical staff in intensive care are running on empty. It's an enormous responsibility. The number of patients has tripled, and our work conditions are far from ideal. We're short on everything, medication and medical staff too, because they're worn out. Often we struggle just to provide basic medical care. But the staff still report every free bed to the hospital administrator. Sometimes up to 30 COVID patients are waiting for a bed in intensive care. In Antioquia, we've had more patients on the waiting list than beds ever since April. We can't admit everyone in time. Even critically ill patients often wait 2 or 3 days for the ICU. They stay in the ER or even on the surgical unit. The Ministry of Health and some regional mayors say there are plenty of intensive care beds. The Health Ministry just informed us that intensive care occupancy fell under 85% today. We have 15.93% capacity. For Yolanda Valderrama, who lost her mother to COVID-19, those are little more than empty words. They say COVID numbers are going down, but I see no sign of that. Our patient numbers have never gone down here. This hospital in Medellin has meanwhile set up intensive care beds in the hallways. They know that in Colombia, the pandemic is far from over.
For more, let's bring in Marika Blofield. She is the director of the Latin America division at Germany's Institute for Global and Area Studies. She joins me from Helsinki. Welcome to DW, Marika. Colombia was the first country in Latin America to receive vaccines from the international COVAX initiative in March, but it hasn't done much to slow the rise in infections. Why?
Well, I mean, many of the vaccines that were ordered have simply not arrived. So at this point, about 1/4, or just under 1/4 of the Colombian population is fully vaccinated, which is actually higher than the global average, but of course it's not enough. And for example, many of those vaccines are now from Sinovac, the two companies that have most supplied vaccines to Colombia so far, Pfizer and Sinovac. And the COVAX mechanism is actually way behind. Colombia bought over 20 million doses for them, and only just over 3 million have arrived, which leads to about 1.5 million people fully vaccinated. And so they're just not getting enough vaccinations into the country. Because on a general level, global production is simply not keeping up with the global need.
America has recorded 30% of all global COVID deaths, while representing only 8% of the world's population. Tell us what has gone wrong there.
Well, Latin America as a region, there's of course differences by country, but overall, they enter the pandemic with very low levels of preparedness. They have high inequalities, weak public health care systems, high levels of informality, high urbanization, and overcrowded housing. And so when governments try to implement social distancing rules in a region where half the population works informally, it's really hard to enforce those if people need to go out onto the streets to survive. Governments also had a hard time reaching those populations to help them to shelter at home. And as a result, and especially in high urbanization, overcrowded housing, the virus spread easily. And now, a year later, it's an even harder trade-off for governments with lots of low-income people, no fiscal space left over. They're out of money to continue with social distancing measures. And that's, of course, feeling contagious now, too, along with the Delta variant.
Now, could Latin America then become the new epicenter of the coronavirus variants, and what would the consequences be for the rest of the world then?
Well, I'm not a virologist, but yes, as the virus spreads, of course, there's more possibilities for mutations, and the consequences, of course, would be terrible. And I think most importantly, that points to the fact that this issue is global, and that a global effort is needed to produce and distribute vaccines as fast as possible in the region. And now would not be the time to be stingy or nationalistic about this.
While we talk about the broader impact of all this, nowhere in the world have children missed more school days as a result of the pandemic on average as in Latin America. What are countries going to do about that?
Well, I hope that they prioritize opening schools. They prioritized opening a lot of the economy, but the schools have remained closed. And that's been devastating for a region where now over half the children live in poverty. And not just school and poverty, but millions of kids have missed their regular vaccinations. And so I think what the region needs to do is actually establish a social contract with children. And that would involve reopening the schools safely as a priority, help families that are struggling with food insecurity, and reinforce preventive healthcare systems for children.
Now, most recently in Colombia, there have been protests for more supportive public policies to alleviate the economic impact of this pandemic. Now, this pandemic has pushed many people into poverty. Is that going to impact who will be in power in the future in these countries?
Well, that's impossible to say because there's so many intervening factors. Let me say, though, that what the pandemic has done is really exacerbating existing fragile institutions, existing strengths in the region. And in Colombia, it might be that the left-wing opposition will pick up pace. Colombia has had a conservative government that has been seen not to do enough to provide social assistance for the population, and regionally hasn't. It's quite a bit behind its regional counterparts. It's a conservative government. There have been massive protests against it. And it may be that this will add to the popularity of a left-wing opposition, particularly in the case of Colombia. But each country has its unique trajectory on this.
Marieke Blofeld of the Giga Institute for Latin America Studies, thank you for your thoughts.
Thank you.
Our viewers want to know more about where the coronavirus variants came from. For that, now over to our science correspondent, Derek Williams.
Is it possible that the same variants arose independently without travel in different places?
The answer to this touches on one of my favorite evolutionary concepts called convergence. It's basically the idea that when different species face similar environmental pressures in different places, then nature can come up with remarkably similar solutions to cope with them. A good example of convergence is, for instance, the protective spines that are embedded in the skin of both porcupines and hedgehogs. The trait didn't arise just once in a common ancestor and then get passed down. It evolved independently in both species because a spiny outside is clearly a good defense against predators if you're small and slow and just want to be left in peace to eat your leaves and insects. Viral genomes also change constantly, and it happens a lot faster than with animals because viruses replicate so quickly and abundantly. The vast majority of those changes will be neutral or even harmful, but a tiny number of them will give a virus an advantage. For example, a mutated gene might change the spike proteins on its surface in ways that allow the virus to slip into cells more easily. And because the SARS-CoV-2 genome is actually pretty small, the chances of specific identical mutations like that occurring in different places at different times is actually fairly high. So we are seeing some of this sort of genetic convergence, but because variants also collect many other highly individual mutations as they evolve, genetic sequencing still allows us to tell them apart.